Hey Plabbers, this is your PLAB partner with a few more questions to stimulate your thinking. Keep learning and improving, reduce confusion and gain clarity. A 64-year-old man presents with nasal obstruction, epistaxis, diplopia, otalgia and conductive deafness. He has a long history of smoking and drinking alcohol. What is the single most likely diagnosis? Okay, here the answers are all different types of carcinomas. So we have to try to localize that there is pressure within the nostrils, conductive deafness, epistaxis and diplopia. The answer here is nasopharyngeal carcinoma. Now as you would know that the eustachian tubes and the tear ducts both open in the nostrils, and a blockage would lead to conductive deafness, earache, and local spread will give diplopia. This is not a pharyngeal carcinoma, as that will not cause deafness. Sinus squamous cell carcinoma in the sinus will mainly give bloody discharge or blockage on one side. Laryngeal carcinoma would have symptoms relating to voice, and hypopharyngeal tumor in the throat will have symptoms of dysphagia. So the answer is nasopharyngeal carcinoma. A 45-year-old woman is having difficulty hearing properly on the telephone. She is concerned because her mother was moderately hard of hearing since middle age. Audiogram shows moderate hearing loss in both ears across all frequencies, and bone conduction is normal. What is the single most likely diagnosis? So this woman has otosclerosis. Now there are no features of tinnitus, vertigo or other cranial nerve palsies excluding acoustic neuroma and Meniere's disease. There is obviously no history of noise-induced deafness, and otosclerosis generally is autosomal dominant, and in middle age years you get progressive hearing loss. There is a conductive hearing loss pattern on tuning fork tests, and medical management is with hearing aids, and stapedectomy is the surgery which is sometimes needed. A man is presenting with few weeks history of muffled hearing and feeling of pressure in his ear, one of the ears, along with recent tinnitus and vertigo. He also complains of double vision when looking to the right. What is the most appropriate diagnosis? So there are some overlapping symptoms of different conditions here, but this patient has acoustic neuroma, which is a benign tumor from the schwannoma, Schwann cell. Now, the symptoms are due to compression of the surrounding structures. Now, double vision would be due to compression of cranial nerves and giving a false localizing sign by causing abducent nerve palsy. Some symptoms are similar in Meniere's disease but will not have double vision. Acute labyrinthitis only has tinnitus, vertigo, and may not affect hearing and will not have double vision. Again, symptoms not consistent with meningioma and otosclerosis. A man has a clear discharge from his left ear after a fight. Where is the discharge coming from? Okay, this person had a fight and that gave rise to a clear discharge. So he is having CSF leak because of fracture of the base of skull. It is not endolymph from the inner ear. It is not a otitis externa. It's not coming from the pinna itself, and obviously it's not from brain, although the question is framed in a slightly confusing manner. Now you can confirm that this fluid is CSF by testing it with a dipstick, and there will be presence of sugar, presence of glucose. Also, such a fluid on a tissue paper will blot into a few layers. A 22-year-old lady came to the hospital with complaints of fever and painful vesicles in the left ear. What is the most probable diagnosis? Herpes zoster near the pinna, also called as Ramsay Hunt syndrome, has painful vesicles. It can also cause swelling around the facial nerve and causes facial nerve palsy. Management is usually with oral acyclovir and sometimes steroids. Here we have a 5-year-old girl with earache and yellowish foul-smelling discharge, perforation at the attic, and conductive hearing loss. She has no past history of ear infections. What is the most appropriate diagnosis? You may think that she may have otitis media with effusion, but the perforation is at the attic, which is the superior part of the eardrum, and she has a foul-smelling discharge. So the correct answer is acquired Cholesteatoma, which is a collection of many old layers of the skin and contains a cheesy material. It is not acute otitis media simply because there is a perforation. In congenital cholesteatoma, the tympanic membrane is intact. All you can see is a very bright, shiny, pearl-like collection behind the tympanic membrane. Otitis externa again can have a discharge but will not have any perforation. Yes, it is always good to refresh the topics that you found tricky. Spend a few minutes reading around those topics that you know less about. Finally, guys, leave a comment or press the like button to encourage us to upload more videos like these.